Hey, if you've ever had that awful, nagging pain right between your shoulder blades, then you are in the right place. We're about to walk through a super effective 5-minute routine designed by a doctor that can bring you some serious, and I mean immediate relief.
You know exactly what I'm talking about, right? It's that deep, annoying ache that just camps out between your shoulder blades. It loves to show up after a long day hunched over your computer or your phone. It's distracting, it's frustrating, and honestly, it's just way too common.
So, what is actually going on in there? Well, the fancy scientific name is myofascial trigger points, but we all know them as muscle knots. Yep, these are just really tight, tense little spots in your muscles, and they're the real culprits behind all that pain. The great news? We can target them directly with this routine. Okay, so to really get rid of this problem for good, we first have to understand what's causing it. So let's start right there.
And the solution? It's actually way simpler than you might think. We're talking about a targeted 5-minute stretching program created by Dr. Jeffrey Pang. The goal here is simple. Use a few key stretches to release all that muscle tension and get you feeling better right now.
First things first, we can't just jump into deep stretches with cold muscles. That's a recipe for disaster. So we're going to start with a quick 2-minute warm-up. This is all about getting some blood flowing to your shoulders and upper back to get them prepped and ready to go.
This part is super quick and easy. Let's start with 10 big shoulder rolls forward, and now 10 rolls backward. Good. Next up, 10 scapular squeezes. Just imagine you're trying to touch your shoulder blades together behind you. Pull back, hold for just a second, and release. Do that 10 times, and boom, you're all warmed up. All right, now for the core of the routine. We're moving on to stretches for your chest and neck. And I know what you might be thinking, my chest, but my back is what hurts. Trust me on this one. A lot of that upper back pain actually starts right to the front of your body. We're going to kick things off with a chest opener. Go ahead and clasp your hands behind you. Now, push down and straight back, and really focus on squeezing those shoulder blades together. You should feel a fantastic stretch all across your chest. Let's hold it right there for about 30 seconds.
Now, why is this stretch so important? Well, think about how we spend our days. Hunched over a desk, a steering wheel, a phone, our chest muscles get super tight, and that pulls our shoulders forward. This creates a huge imbalance, putting a constant nagging strain on our upper back muscles. This one stretch starts to correct all of that.
Next up, we're targeting the trapezius muscle. Oh man, this is a major problem area for so many of us. Just gently pull your head over to one side like you're trying to bring your ear to your shoulder. Hold that nice stretch for 30 seconds, and then of course, repeat it on the other side.
And listen, this is so critical. This isn't just about muscle tension. When your traps get incredibly tight, they can actually start to pinch the nerves nearby, which causes a whole different kind of pain and discomfort. So this stretch is doing double duty. It's releasing the muscle and releasing that nerve compression.
Okay, let's hit another key muscle, the levator scapulae. For this one, turn your head so you're looking down at about a 45-degree angle, kind of in the space between your chest and shoulder. Then, gently use your hand to pull your head down. Hold that for 30 seconds, and then switch sides. Here's a pro tip. While you're holding it, you can gently move your head a tiny bit side to side to hit different fibers of the muscle. And this stretch perfectly explains a concept called referred pain. It's a total game changer. What it means is that the pain you're feeling in your shoulder blade often isn't actually coming from your shoulder blade. The real culprit is a knot in a neck muscle like the one we just stretched, and it's sending, or referring, that pain signal down into your back. Wild, right? Okay, so we've worked on the front of the body, which is causing all that pulling. Now let's move directly to the back and the spine itself to bring it all together for some real relief.
It's time to target the rhomboids. Yep, the muscles located right between your shoulder blades. So clasp your hands out in front of you, push away, and really curl your upper back, tucking your chin into your chest. You should feel a great stretch right in that spot where the pain always seems to live. We'll hold this for 30 seconds.
Your rhomboids are absolutely critical for good posture, but that chronic tension from slouching all day makes them super tight and weak. So by stretching them out, you're not just getting temporary pain relief, you're actively fighting back against the bad posture that causes the pain in the first place.
For our final stretch, let's work on getting some mobility back into our spine. While you're sitting, just rotate your whole upper body about 90 degrees to one side. You can gently use the back of your chair to get a little deeper into the stretch. Hold it for 30 seconds, and then, you guessed it, repeat on the other side. This rotation is amazing for your thoracic spine. That's just your upper and mid back. If you sit a lot, this part of your spine can get incredibly stiff and locked up. This stretch directly counteracts that, helping to break up that stiffness and get rid of the pain that comes with it.
And that's it. That's the whole 5-minute routine. But listen, doing these stretches just once isn't going to be a magic fix. There's one final, absolutely critical piece to this puzzle if you want long-term relief.
And it all comes down to one single word: consistency. Seriously, the most important part of this routine isn't doing a stretch perfectly, it's doing it regularly. That's the only way you're going to retrain your muscles, fix those imbalances, and find relief that actually lasts.
So what does consistency look like? Well, Dr. Peng's recommendation is pretty simple. Do this entire stretching program once or twice every single day. That's it. Make it a non-negotiable part of your day, especially after you've been sitting for a while.
Look, it's just 5 minutes. That's all. 5 minutes to undo hours of damage from sitting, to release all that tension you're holding on to, and to finally kick that nagging pain to the curb. The routine is right here. The only question left is, are you ready to make it your daily reset?